Joanne, she's 56. She's coming in with a blood pressure that was 170 over 98. And, we started her on 5 of amlodipine. Then she's coming back at 160 over 96. It's a high blood pressure. So what are we telling her target should be these days? Is it now less than 130 over 80 for everyone? Is that just the easier way to go? Or do we have different thresholds?
So the AHA-ACC guideline in 2017 put out 130 over 80 or less than 130 over 80 for everybody as your goal once you have a diagnosis of hypertension, with a couple of small caveats. For instance, use your judgment in really older, frail patients when you're worried they might fall. That's up to you, and they're not taking that away from us. Then, there's all this controversy because the AAFP doesn't agree with that, and they really think that if the data hasn't shown that there is specifically just a mortality benefit, not cardiovascular benefit, but just mortality benefit, that is not strong enough. And so that's why they're saying 140 over 90. This was all had also come up with JNC7, and we have a lot more trials now. We have now 4 trials that have come out in the last 4 years that have all shown that intensive blood pressure lowering across broad ranges of patients is beneficial. In SPRINT, they found that it was even slightly more beneficial in some of the analyses in people over 75. And so that older patient thing doesn't necessarily apply. It's the older plus frail patient that you really might want to be more concerned about. But older age itself isn't enough. So pretty much in everybody, we're using 130 over 80. KDIGO, which is the Kidney Clearinghouse for international guidelines, they are pushing for less than 120 over 80, claiming that they're the only ones really making the caveat that it has to be a standardized blood pressure. Everyone else is also saying, please make sure it is a truly correctly performed blood pressure. I think the reason for KDIGO is that our kidney patients have more to lose. There's a lot higher risk of patients with chronic kidney disease having major cardiac events. And so there could be the potential for greater benefit by more intensive blood pressure lowering. More and more of the international guidelines are pushing more towards, if somebody can tolerate it, maybe think if you can go lower. I think the goal of all of this is a little bit paternalistic to just get us thinking that 120s are normal as opposed to 130s being normal. Whereas I think that when I was in training, many people sort of treated 140s as normal. So it's all just sort of attempting to try to swing the pendulum more and change our sort of expectations of what a normal blood pressure is. But I don't think that in most people we can reasonably achieve consistent blood pressures less than 120 over 80 without seeing a lot more side effects.